Last week I talked about the implications of filarial worms with multiple sclerosis and other chronic diseases, other neurological diseases. But today we're going to take a deeper dive into what are filarial worms, where do they live in the body, how do they make us sick. That's the next step. And I'm going to go through a several-part series on these filarial worms. And why? Because I believe that they are one of the main infections that are causing multiple sclerosis, and I'm sure they're involved in many other neurological diseases. There's several reasons for that. If we haven't met, my name is Pam Bartha, and I'm the author of Become a Wellness Champion and the founder of Live Disease Free. And it is my huge privilege to share with you, awesome, you guys can hear me, this topic. I was diagnosed with multiple sclerosis many years ago, over 30 years ago. And by the grace of God and a lot of work on my part, I learned very early on that MS was caused by infections. I learned a lot about Candida. Then I did do parasite treatments, but didn't know much about parasites. Fast forward 30 years, we have helped over 600 students in the Live Disease Free Academy. We've learned a lot. And one thing that we've learned, thanks to the work of amazing hero doctors. So the first reason why this is such an important topic is Dr. Alan McDonald found these small parasite worms, these small parasitic worms in the spinal fluid and brain of every single MS patient that he looked at, and lots of them. The second reason why it's so important is that a few years ago, one of my students in the academy, she was a med student at that time, and she was diagnosed with multiple sclerosis. She looked at her blood, and she looked at another patient's blood that had MS, and both herself and the other person, she said it was quite easy to find these filarial worms in their blood, which they should not be in your blood. And we're going to talk a lot about these worms today. The third reason why it's so important is that animal studies have shown that when these small worms get into the central nervous system of domestic animals, those animals have symptoms identical to multiple sclerosis. They have extreme fatigue, they have balance issues, they have numbness, they have paralysis, they have drop foot, they have spasticity, they have all those symptoms, and blindness. And that's the third reason why it's so important to study this. And the fourth reason is that as my students, we've been working together and I'm helping them to build a plan to treat. As they are getting the medications they need prescribed that treat these types of worms, that's helping them to recover so much quicker. So we see it in the academic field where Dr. Alan McDonald is finding them. And then another, like I said, the student is finding them in her blood and in another person's blood. And then also the animal studies and what we're seeing in our students. So there's so much evidence that shows that this type of infection, these parasites are big players in causing the symptoms that cause multiple sclerosis. And I believe they are involved in many other types of chronic diseases, including PLS and possibly ALS, etc. So we don't have all the same infections, but we're seeing that students with different neurological diseases, they are recovering with similar parasite drugs that would treat these worms and others, of course. So that's why we're talking about this. And today we're going to go into what are filarial worms. What I'd like to do is I put together some slides for you, and I'm going to head over to the slides right now. And hopefully the audio will sound good. Hello, you guys can hear me? Awesome. So what are filarial worms? They are, let me go to the next slide. So before I go into what filarial worms are, this is kind of like the breakdown of the next few videos that I'm going to do. So what are filarial worms? The next one is how do they cause disease in animals? The next one is the relevance of these infections in neurological diseases such as MS, PLS, and others, testing, and last but not least, treatments. So when we have an infection of these small worms, they're very small. They're like thread-like parasitic nematodes. The adults can range between 2 to 10 centimeters. They are called filarial worms. because they're small, and so that there can be adults, but there can also be microfilarial worms, or that's the larva, that's the immature form. They would be smaller than the 2 to 10 centimeters. So we'll talk about both today. They're all different parts of the same life cycle of the same worm. Most, if not all of these, I'm sure all of these that I've looked at, they are spread through biting insects. The majority are through mosquitoes. There's at least 8 species that are known to cause disease in humans. They can impact our lymphatic system. We'll talk about that today. They can infect our skin. They can infect different organs, lungs, abdominal cavity, etc. And so they can move into many different parts of the body. And it really depends, I believe, on the species. And then sometimes they just make their way into areas that they normally don't live. They cause cerebral spinal nematoidiasis, which means in the spinal fluid, the brain and spinal fluid, they're finding these nematodes. And that's what Dr. Alan MacDonald found in humans. And that's the first discovery. It's a huge discovery. Let's look at lymphatic filariasis. Filariasis. There we go. There's some really good tongue twister words here. So with this type of worm, it infects many, many people, over 120 million people in 72 countries. So this worm is more common in the tropic and subtropic countries like Asia, Africa, West Pacific, etc., Caribbean, South America. Most of these people will be asymptomatic and they will never develop clinical symptoms. But in the advanced cases, they can develop lymphedema, so swelling of lymph tissue, and also lymphatic system, and also elephantiasis. So maybe you guys have seen a picture like that. I'll just show you a picture. It's really, really awful. And I just wanted to talk a little bit about this type of filarial worm. And these types of filarial worms, so we're going to talk about this one and a couple of others, because a lot of these filarial worms are very similar in how they infect the host. So we would be the host, or another animal would be the host. And so with filarial worms, with the ones that cause this lymphatic filarial infection, number one, they are passed on to humans through some type of biting insect, and it's a mosquito, I should say. So they're called vector-borne infections. So they're passed on through a mosquito. The mosquito will bite the host, the human, and the larva, the immature form of the worm, will be inside the mouth parts of the mosquito. And they're not injecting it into the wound or the bite of the mosquito, but they're just dropping off or depositing the immature form of the worms on the skin surface. And so as soon as the mosquito's done drawing blood from us, or we smack it and kill it, then they don't know for sure how, but there's some kind of signal. So the little immature form of the filarial worms, they make their way to the wound and they move in, and they travel down into our tissue, and they make their way down to the lymphatic system. That is their favorite place to live. What's really interesting, I'll share that in a minute, but so they move into the lymphatic system. That is their preferred home, and they grow there. They turn into adult worms in time. So what's really interesting is that the adult worms that live in the lymphatic system, they get a lot of nutrients from our lymph fluid, and they do not cause an immune response. I've talked about how a lot of these microbes have ways to cause inflammation and immune dysfunction. So it's kind of like they're making themselves blind to our immune system, so our immune system is not mounting a big inflammatory response, and they're just living there. So as the adults, they grow up and they develop. I just wanted to share here, the adults can live 5 years or longer inside of us. It's nice to kind of have a sense of what the enemy is like, right? So these ones can live 5 years or longer inside of us. There are male and female filarial worms that cause this condition, and they mate, and so they like I said, the babies, they move into the lymph fluid, they grow up there into adults. And then once they're adults, they mate and they produce more larvae, which is the immature form. And then that larva then moves out of the lymph fluid and it moves into the blood. And that kind of completes the life cycle in the human, because then as it moves into the bloodstream and it moves into the smaller blood vessels, and then the mosquitoes pick them up and they take them off to another person. What's really interesting, there's a couple of nuggets that I learned here. Number one is how they can cause our immune system not to have a strong reaction to them. So we could be infected with them for a long time and not really notice any kind of disease symptom. And that's a real problem with diagnosis, because we could have been infected with them for several years before and not really noticing a big difference. It's when they start to move into certain areas, and I'll talk more about also when they die. They also contain, it's called an endosymbiont, which is a bacteria that lives inside of them. They kind of have this mutual living arrangement where the bacteria benefits from the worm and the worm benefits from the bacteria. But as soon as the worm dies and that bacteria is released, and even just the dying worm, that's when there's a stronger, it's called antigen load, and then we have an immune response. And that's where there can be a lot of the war going on, and you can have cellular debris from the war, and then we get, they call it calcification, and then we get blockage of the lymphatic system, where we can end up with a condition like what this poor person is dealing with in this picture here, where there is extreme swelling of limbs, etc. And so another thing that I learned from these worms is that they're nocturnal. The immature forms are present more in the blood after midnight. So that corresponds with the feeding cycle of mosquitoes. Apparently mosquitoes will feed more at night. And so these little filarial worms, we'll call them the microfilariae, those are the immature forms. They will make their way into the blood to be picked up by the mosquitoes, and they are more present in the blood at night. And so that's a big thing for testing, right? And that's really important. So as we want to have tests for looking for these either filarial or microfilariae, then we have to understand that all the research I've looked at is that they're nocturnal, they feed more at night, and so they will be present more in higher numbers, easier to find in our blood at night. And I'm really hoping that we can get started with a test soon, for a blood test. That's my goal. So they know that these female worms that live inside the lymphatic system, the ones that grow up, they can produce hundreds of thousands of microfilariae larvae in their lifespan, in their lifetime. And the small microfilariae, they only live about 6 months and then they die. And when the worm dies, then that's the time when, again, we end up with the immune reaction. Also, it's not just the worm dying, but also when it's dying and releasing that bacteria, that's what seems to be causing a really strong Th1 and Th immune response to Th1 and Th2 immune responses. So that's where a lot of inflammation is produced. So we can go for a long period of time having something like this. And again, this is more in the tropic and subtropic areas, but you'll see that a lot of these filarial worms have really similar life cycles and similar causing different symptoms depending where they are living in the body. So that is the first one that I wanted to talk about. And then I also wanted to mention that there is another one, which is river blindness. I'm just going to grab that here because that's really interesting. So this is a filarial worm that is passed by not a mosquito, but by a fly. And so the fly actually doesn't stick the mouth part inside of us or whatever that's called. This is where the fly literally basically breaks open our skin and drinks the blood. But again, the worms coming from the fly, they move into us or into the humans. This filarial worm that causes river blindness, it's more prevalent in Africa and also the Arabian Peninsula and also South and Central America. It's another thing that we have to remember is that a lot of people travel too. So although it's not prevalent in some of the other countries, the developed countries, but it certainly could be present. And we'll talk about one that could be more prevalent in a minute here. So again, these same filarial worms will have that relationship, that symbiotic living relationship with that bacteria. And again, that bacteria actually, like if you're killing off the worms, very often if you get an overload of that bacteria, you get a very strong immune reaction. And this can cause blindness for sure, and it can cause a lot of other symptoms in people. And what's really interesting is that a lot of times these filarial worms, if they're just living in us because they have that way to fool our immune system, that we don't notice them. We don't have a lot of symptoms, and that could be if our immune system is healthy and strong enough and it's not getting an upper hand, then we could have these worms for a long period of time and not really notice it. So it's not like we just get like bitten by a tick and we get Lyme disease immediately. It can be something that is a chronic condition that's lasting or kind of building up over years. All right. And then another really important nugget is that the researchers are saying that when we have a negative reaction to a parasite drug treatment to treat these filarial worms, again, it's not the drug that is really causing the problem. It's the die-off. It's when we're killing off the worms and, when they're breaking open and releasing the bacteria and also their internal parts, we can end up with a strong immune reaction. And so if we have a really high population of these filarial worms in our body, we're going to have a stronger die-off reaction. So that's another really, really important point. Now I want to get on to the one that I think is most relevant to us, and that is a type of filarial worm that's more common in livestock. And this is really interesting because in Canada, in the rural parts of Canada, that's one of the highest diagnoses of multiple sclerosis in the world. And I know I grew up on a farm, and it's not maybe for everyone, but I know that it's more common in rural parts of Canada. And in rural parts, we have livestock. We have more livestock. I grew up with all kinds of livestock, and we just didn't know that this could be a problem. So Ceteria species, so there could be more than one type of Ceteria. There's Ceteria digitata. There could be other ones. And that's what Dr. Alan McDonald has said. So with any kind of living organism, the way that people can communicate around the world is that they give it a first name and a last name, a genus and a species. So Ceteria is the first name, and digitata would be one of the species, but there could be other types of Ceteria, like different kind of cousins. They're similar, but not exactly the same morphologically. So the anatomy of this worm is that it can grow up to 15 inches long. The female worms are longer than the male worms, and they have a tapered body towards the tail, which is coiled. Again, the life cycle is very similar. We get this type of worm, or the livestock would get this type of worm from mosquitoes. So it is, again, a vector-borne infection. It's transmitted by mosquitoes. The mosquito that's infected with the larva, it will definitely infect the host. And so whether it's us or whether it's domestic animals, and this would be cattle, buffalo, sheep, goats, horses, etc. And so once the animals are infected with the larva, instead of moving to the lymphatic system, instead of living in the tissue, so the one that causes river blindness, it likes to live more in the tissue. And the one that's causing this disease, cerebrospinal nematoidiasis, it likes to live in the abdominal cavity of the animal or of us. And the immature forms, they live there, they grow, they eat the nutrients that our body provides, and then they produce the immature forms, the microfilariae again, and they move out into the blood. And that's the very similar life cycle. They find their tissue that they like, they start to they grow up, they reproduce, and then they send off their babies. The babies go off into the bloodstream, and then they're picked up by mosquitoes and transmitted to another. And they have another little life cycle in the mosquitoes, but that's how they perpetuate their life cycle. It's actually fairly complex. So the problem is that with the little immature forms, and this is what we don't know. We don't know exactly which species of the filarial worms. We know for sure that filarial worms are present in people that suffer with MS in their central nervous system. We know that they're present in their blood, but we don't know which kind. So that's the thing. And Dr. Alan McDonald said there could be multiple different types of species, of cousins. So with this one, the Ceteria species, and I'm just talking about the digitata one. So as the immature forms, they move into the blood, and they're supposed to move into our smaller blood vessels to be picked up by the mosquitoes. Some of them kind of get lost, and they end up in our central nervous system. They can end up in different parts of our body. When they end up in our central nervous system, that causes the cerebral spinal nematoidiasis, and that is where we have the symptoms of multiple sclerosis. And that's because we know that in animal studies. And I'm going to spend some time going over that with you in a different video. We're going to look at a bunch of different animal studies of when they, like how these, like which types of animals and what kind of symptoms they were having. So that is the issue, that these worms, like if they just stick with the abdominal cavity and move into the blood, and they're moving into the mosquitoes again, then we don't have a lot of serious chronic disease. Maybe when they die, if we had, let's say, a very high population, we might. But for the vast majority of the problem, it's when they're moving into areas that they normally don't live, into the central nervous system. And why would they do that? And those are lots of questions. So, we have those of us that for different reasons, like whether it's GMO, whether it's different medications, we end up with leaky gut, we end up with leaky brain. And so maybe we're more susceptible to having them transferring into our central nervous system than if we were healthier and stronger and we didn't know, or maybe it's the number of them, I'm not sure. But we're seeing more and more people that are dealing with all kinds of neurological diseases. And these filarial worms, I'm sure, are one part of it. So again, this is a vector-borne infection, and they're transmitted through mosquitoes. These ones live in the cavity, the abdominal cavity. And I believe that this is probably like the genus and species, we're getting closer to the ones that really impact us. And so the nuggets I learned here are that they're considered non-pathogenic if they just simply go where they're supposed to go. If they're in small enough numbers in our body, then our immune system can deal with it. But it's the wayward ones that end up in the central nervous system that are the problem. And diagnosing, we're going to talk more about that later, but I'm going to go to your questions. Oh, shoot. I don't think that I didn't share these. Okay, so sorry. Here is the life cycle. I just got so much into my notes. So this is the life cycle of, you can look at it later, the life cycle of the filarial worm that causes the lymph issues, where they're living in the lymphatic system. So that is the life cycle of that one. And the other one is, so those are the notes I had for the Ceteria species, and they're being transmitted through livestock, but also to us too. And the last one, that's a picture of a Ceteria filarial worm. So that's an adult worm. All right, I'm going to go to your questions and see what you have for me. Hi, Kia. Hi, Janet. Hello. Hi, Marie. Hi, Maureen. Awesome. Hi, Rick. Do you guys have any questions about these filarial worms? Awesome. So we're going to talk more about the animal studies. We're going to talk more about diagnosing and treating in future Facebook Lives, but I just wanted to kind of keep these nice and short so that you can get the really important information, become educated on it. And this is the direction you need to go in recovering from chronic disease. Maybe not all of us have filarial worms, but they're really, really common in people that are dealing with neurological diseases. So if we're dealing with things like the spasticity, the muscle cramping, and balance issues, and blindness, and fatigue, and numbness, and paralysis, like all those things, we're seeing them really, really consistent, that those people that have not just MS, but they have other neurological diseases, that they respond really well to treatments that treat these filarial worms. And it's really super exciting, and we need to get this word out. So make sure that you share this video, and also please like it. And if you want to hear, I'm going to be coming on more often sharing. I got some amazing new information, or I should say research, from Dr. Alan McDonald that was just published in August, the end of August this year, where he is finding tapeworm larvae also in the central nervous system of people that suffer with MS. It's crazy. So, and I've done videos about different studies where they found the immature form of tapeworms in the central nervous system of somebody, and they had symptoms of MS. They didn't have they found lesions, and they operated on the lesion, and they found the immature form of the tapeworm. So this is our answer. This is how people are recovering, is that we have to treat the root cause. We can't suppress our immune system. And if you are like, wow, Pam, I didn't even know there was such a thing as that parasites are involved with MS, then make sure to watch my videos. We've got a whole playlist on infections, and start to make changes to your lifestyle. Start to change your diet, and start to change, there's certain things you can do to start to get yourself ready to treat. When you're ready to treat, make sure to reach out to me. And that would be watching my masterclass training, so that you learn more about these infections, and also case studies of people that have recovered and the steps we take to recover. And then you can watch my masterclass training. And then if you're ready to treat and you need help, I'm here to help you. And you can become a wellness champion and join the academy. So make sure to watch my masterclass training. Hi, Kate. When the worms live in the abdominal cavity, what is the best way to clear them from the body? Could they also live in the fascia? They could. Like, it's just that different types of filarial worms live in different parts. So the filarial worms that cause the river blindness, they go more in tissues. And then there are, like I said, there's just all different ones that live in different ways in different areas. And I believe, Kate, too, that sometimes they're just moving into areas that they normally wouldn't live. So they might end up in organs that they normally don't live. And so this is why you want to have treatments. When you're looking at treatments and working with your practitioner, you want to make sure that you are using treatments that will be working more systemically versus working just in the intestines. So there are parasite drugs that will just treat the intestines. And then there are others that will go through your blood system. Some of them are absorbed better than others. And then there's sometimes things you can do to make absorption better by having extra fat. And then also, for those of us that are dealing with MS, we have to be considering finding treatments that will cross the blood-brain barrier, because they are in our central nervous system. So it's not enough to just treat the ones in our blood. We want to treat systemically all the way. And that is a little bit of a limitation with the treatments. And that's why we have to use strategy for sure. We have to definitely do a lot of things, and that's what we do in the academy, is stop feeding the infections, support the body. And then when you're treating, like once you really build the plan of like what kind of infections are you dealing with and what treatments are best for them, we use a multifaceted approach. So we will use oxidizing agents, we'll use anti-parasite drugs, and we will use herbs, all in combination, but not all at the start. For students that are really, really sick, they just start with what they tolerate, and they increase it and increase it. And that's a really important point I wanted to share with you, is that for people that have a very high population of these filarial worms in their body, that there is a concern to kill off the die-off too quickly. Dr. Alan McDonald talks about it. So you have to work with someone, you have to know what you're doing, because if you kill them off, these parasites, too quickly, you can get a very strong immune reaction. And if you get a strong immune reaction in your central nervous system, that can cause seizures. And Dr. Alan McDonald said it could possibly cause death too. And again, it's not just from the worms dying, but also from the bacteria that's living in them that is causing such a strong immune reaction. So this is why you have to work with someone. This is not something that if you're dealing with chronic disease, you should just try to find it and, take something, because you could really hurt yourself. And these parasites, they run the risk of becoming resistant. So we have to take enough to treat them, and we can't just expect to pop a pill. We have to use a holistic approach. And then we also have to take an effective dose, and we have to our students do is they bring it in slowly so that they don't have strong die-off reactions. So all these things are things we've learned from coaching so many people in recovering. Hi, Marianne. Hi, Sean. Hi, Brian. So how big? So this one is small. I think these are up to like just a few centimeters long. Some of our students are passing larger worms that can be anywhere up to like, they're over 2 feet long, some of the roundworms that they're passing. But these would be smaller ones that are present in blood and in lymphatic system, in our lymph tissue or lymph fluid, I should say, and central nervous system, etc. I'll see if there's any other last questions. I know there's a little bit of a time lag here, but I think that's it. Awesome. Oh, you're very welcome. Oh, I will be posting the most recent research from Dr. Alan McDonald. I was just in correspondence with him just a week ago or so, and just really, really exciting. I mean, it's not exciting that he's finding tapeworm larvae in the central nervous system, but it is important that he is finding that, because that helps us to understand another component. And that could be why some students test really well for the the tapeworm treatments, while others test well for these small filarial worms. And there is overlap, of course, but some students were seeing that they test for 3 or 4 specific treatments that are more specific for the tapeworm, which is interesting. And tapeworms are tough to treat also. All right, so with that, I'm going to let you guys go. And going back to these slides here, the next week's topic is how they cause disease in animals. So I'm going to share with you just a few studies so you can see how they affect different animals. It's really shocking. I don't understand why they have never made the connection between MS, neurological diseases, and these filarial worms in animals. Actually, in the 1950s, when that researcher published the paper, he made the connection, but nobody picked that up until Dr. Alan McDonald did. He really is a hero, and it's really sad that his information, his research is not getting out. So make sure to share his lecture with everyone you can, with your neurologist. They might not buy into it, but share it with them. Share it with your integrative practitioners, with your functional medicine doctors. We need to get this to go mainstream, because I really believe with all of my heart that this is one of the very important things that help us to really fully recover, is treating them. You're very welcome, Maureen. Hi, Sean. Do you have any more worms that you'd like to share with us? Not pictures here, but I definitely will again. Absolutely. You're very welcome. So with that, I'll let you guys go, and I will see you next week. Make sure, if you haven't watched my masterclass training and you're ready to treat, make sure to watch that, and it'll be posted in either with a video or just below in the feed. So with that, take care and bye-bye for now.